Hey, what's going on, guys? Joe Farrells here, doctor of physical therapy, owner and founder of Farrells Consulting and Physical Therapy. I wanted to talk to you guys today about a very important topic that I think would be super helpful for you, whether you are a PT in home health or an outpatient or in the acute care setting. I think that this video and its contents will be super valuable for you. But before I get into this video, I want you to go ahead and hit the like and subscribe button below. Um, by doing so, it really helps me get my information out to more people and help more people. So I really do appreciate it. So let's get right into it. So what I wanted to talk to you tonight about was how to do a physical therapy evaluation in Spanish. Now, keep in mind that I am not a fluent or the most perfect Spanish speaker. However, I have done hundreds and hundreds of physical therapy evaluations in Spanish and have gotten the patient to buy in and comply with the uh, physical therapy plan of care. When I first started, I was terrible. I was not good at speaking Spanish. I wasn't confident. I didn't know where to start. It was very awkward, and I'd get a lot of anxiety before doing these evaluations. And so one day I told myself that, listen, this is going to happen. This is the setting that I'm going to be working in. I work in home health as well. So I need to learn how to do this, or it's just going to continue to be super difficult, and it's just going to cause me anxiety. So I decided to do something about it, and I decided to just practice and learn Spanish just good enough so that I could get more comfortable with an evaluation, complete it quickly, and have the patient understand exactly what's going on. Before I delved into learning more about Spanish and how to do it, um, I noticed a trend that many of the patients were either falling off, didn't understand what was going on, and it caused a lot of issues for me as a therapist because I take great pride in making sure that my patients know exactly what's going on and knowing what to expect. So when there was this language barrier, I knew that I had to do something about it. So today, I wanted to teach you how to do a physical therapy evaluation in Spanish, and I'm just going to go through it in different parts. This is going to be part one, so uh, you can go ahead and just follow along. Feel free to take notes if you want, but I'm just going to talk to you guys and explain to you exactly how I do it and how I do it efficiently. So, my main goal and objective for making this video is to be able to teach you guys how to complete it efficiently and quickly, and be able to have less anxiety when you have a Spanish speaking only patient, and how to get more confident in being able to explain things and understanding things from the patient. So I think what's really important about evaluation is that patients understand what your role is and who you are and what your job is as a physical therapist. I think that sometimes there might be some blurred lines where they think that you're the nurse or the OT or the doctor, the physician. So you want to be very clear about who you are and what your role is. So that's part one. Part one is introduction, okay? In the introduction, you typically want to state your name, your credentials, basically that you're the PT, what you're there for, and you want to establish some type of trust and rapport with the patient, as well as identify that it's the patient with patient confirmation, name, date of birth. All right, so that's going to be part one. I will break this up into a few different videos. That way it's not all packed into one video and it's easier to follow. So part one is introduction. So when I go into the home, I typically go in, and when I see the patient, I'll say something super simple like, ¿Cómo estás? You know, that just means, how are you? Okay, in Spanish. And I have other videos on that. You can go ahead. I'll post the links to my other YouTube videos below. But I will go in and I will just say, ¿Cómo estás? All right. And typically the patient will say, muy bien. They'll give you an answer. And the thing is, you don't have to fully understand what they say. As long as you stick to a certain script, they're going to give you certain answers, and then you just flow with the script. So that's kind of how I've done my physical therapy evaluations in Spanish. It's been much more efficient, much easier, much quicker. You feel more confident, and the patient gets the basic gist of what's going on, and they're not left in the dark wondering, who is this person and what were they doing. So say, ¿Cómo estás? Okay. Me llamo, which means my name. Okay. Me llamo is Jomar. Okay. Yo soy terapista con, which means I am the therapist with, and then just state your agency's name. And typically they understand that. All right. So, ¿Cómo estás? Me llamo Jomar. Yo soy terapista de física con, state your home care agency name. Yo soy aquí, so I am here para tu evaluación. So I am here for your evaluation. Typically they'll understand that and they'll get the basic gist like, oh, okay, this guy is here for my evaluation for therapy. And that's basically all they need to know. All right. And then just to confirm them, I'll say, tu cumpleaños es, that means your birthday is, and then just say you can say it in English, they'll typically understand that, or you could say the numbers, and they'll typically understand that as well. So that is basically how I start off my evaluation. Number one, you're asking them how they are, how they're feeling. Number two, you're stating who you are, what your role is, what your job is, and what you're there for. And then you're identifying them and confirming their date of birth. So that is part one of the how to do a physical therapy evaluation in Spanish. I'll see you guys in my next video. I'm going to be posting it here soon. I'll see you then.